there any OFA or other central organization that is marshaling volunteers on this issue? So that's going to be another one of those things we want people to walk away with. Where can you go? Where can you volunteer to work on moving this forward? Because again, this is something where it's going to take all of us. I'm going to grab a piece of it, and then we'll let other members of the panel grab some too. So we know that OFA, because now Brandon is here, Dr. Flowers gave you PNHP, Physicians for a National Health Plan. There are a number of them listed on some of the literature if you picked up any of the things that we printed. Yes?
That was my question, and what I didn't quite get to was, I volunteered for Obama, and OFA is the sort of the remnants, the reconstituted Obama campaign. And one of the reasons it was such a great experience, and I think one of the reasons...
Yeah, and one of the first things that we're going to be doing is a listening tour to sort of gather folks back together into that organization and hear how we can customize that organization to fit Virginia. And I get what you're saying. I promise I'm getting to, I think, the crux of your question.
Well, it doesn't sound like we have, if Congressman Scott was talking about, we got to get something happening in 2 or 3 months. I don't think we have time to sit around and listen and get more stories, do we? Don't we all sort of know what the stories are?
I think that's right. So, yeah, sort of when I was speaking before, right, I was talking about the urgency of organizing right away. So I think we do both of those things on parallel tracks rather immediately. And we need, truly, in order to rebuild that organization, the way it was built during the campaign was bottom up from all of you. Staff acted as a catalyst to sort of help channel people's energy. But certainly as someone who was on the campaign myself, when we showed up in states, people were already working and excited and energized and organized, right? And it just took staff to sort of harness some of that energy, and we learned a lot from volunteers, and we wanted to follow that similar model. I think it gets a little bit more complicated with an issue-based focus, quite frankly, because there's more room for nuance, and that's why we need to do a lot of listening, because we have to figure out where are the common threads. It was very easy for us to all say, we support Senator Obama, we support President Obama, and we came at it from a lot of different angles, right? That was the magic of the campaign. We worked side by side with people that we may never have found ourselves in a room with before, and we forged friendships across all sorts of lines in the process of that work. It gets more complicated when it's on an issue-based focus. It's a little bit more of a struggle. That doesn't mean it's impossible, it's just a new challenge for us. Certainly, when those of us who were on board early started on the road towards electing Barack Obama president of this country, most folks thought that was an impossible thing. So though it's challenging for those of us who come to the healthcare debate from different angles with a different perspective to build as broadly as we did during the campaign, I certainly believe that we can do it. And it takes organizations working in coalition as well. I don't think they're to agree on, some place to start from, somewhere in some way that we can with our neighbors say, people can't wait for health care any longer. We've got to cover more folks, and not just do we have to cover them, but we've got to get them that primary care that was talked about, and we've got to get them that quality of care, not volume, but quality. So I think I would invite you, as a community member concerned about this, to be a catalyst in your community to bring folks together. Utilize the infrastructure of these organizations and figure out how to work cross organizations. I certainly think that we can do it, but it is a challenge, and OFA offers one infrastructure to do that. We do have our Stories tool online, and now that Stories tool is going to be populated with the people that are needed to build the numbers. Now that we have staff here, we can reorganize at the neighborhood level, which people have already been doing before we got here, quite frankly. But we can help knit those pieces together. And we also, Tara, will you just wave your hand quickly? We have Tara in the audience who also has a healthcare declaration form with her, which is an organizing tool that folks can take and use or fill out to sort of indicate their support, at least for the principles. And where we go from there, I think, is up to the organizing efforts and the direction given by the community.
Dr. Miller, and then Congressman Scott.
Hello, I'm Dr. Susan Miller. I'm a family doctor. I have a story really similar to Laura. Middle-class practice out in Midlothian, and most of my patients had insurance. But 4 years ago, I left private practice because I was so disgusted that I was propping up a broken system, and my patients were getting shafted too. I'm now on the faculty at the medical school, and I do health system redesign, and I'm a patient safety fellow, and I just became a physician informaticist. So I can tell you a whole lot of ways that the system could be better and could be cheaper. But I ran up against a wall, which was the financing system, and that's why now I am the organizer for the Virginia branch of PNHP, Physicians for a National Health Program. So this person over here asked, what can we do and how can we hook up? And this is what I tell you, if you're a doctor, you need to join PNHP because they've been laying the foundations for this for the last 20 years, and all these activist physicians here are all members of PNHP. If you're a nurse in this audience, go find out about the California Nurses Association because they have been leading the way, and they've passed single payer twice in the state of California just to have it vetoed by Schwarzenegger. So they're organizing nurses all over the country. If you're a patient, go to Healthcare Now, and don't be fooled by Healthcare for America Now. Go to Healthcare Now. They are the single payer option, and they are the ones organizing the rally. If you can show up in DC on July 30th for the Healthcare Now rally for the single payer birthday of Medicare, that would be fabulous. We need 1 million people to show up on the mall. If you have other interests, like, if you're a small business person, there's now the Leadership Coalition, which is getting together all of the single-payer people. So the Leadership Conference for Guaranteed Healthcare is the national organization, and in Virginia, there's the Leadership Coalition for Guaranteed Healthcare, which is the state organizations. And so there's lots of unions that have signed on, and there are other businesses. So you can find a niche, and we can all work on this together.
And I think it's important, this forum tonight is an excellent idea. Plus, everybody belongs to different organizations. We need those organizations that you belong to endorse and pass a resolution supporting single-payer plans so that everybody gets the idea that groups that you might not have thought were supporting single-payer are in fact recognize the cost savings and the fact that everybody's covered, it's more efficient, and that's actually what people will want. We've got to actually change the polls. The more and more people in the Gallup announces what the results were, it looks better and better. But it's a campaign. There's no magical way of doing it. But the more support that you're showing, the better response you're going to get. And again, I can't overemphasize the need to keep this thing going through the campaign. Because as you invite candidates to come out and debate issues, organizations who have endorsed a single-payer plan can sponsor a debate and have the candidates come out. And if they don't come out, that becomes a political statement. That the consequences of refusing the debate. And so I think it's an ongoing campaign that, particularly as you show resolutions, and physician groups are extremely valuable because they're persuasive in healthcare policy. Nurses, obviously, are persuasive in the healthcare debate. And more organizations, civil rights organizations, who need to make sure that they're making endorsements. Other groups that, social and civic organizations that you belong to, make sure they study the issue and come up with a good statement about why you believe the single-payer plan is the best option.
The Unitarian Church, the Lutheran Church, those are just two that I can